When you decide to help, it needs to be discreet and tactful, given with lots of hugs and reassurance. As an example, in my own family, every few months, my sister and my niece and I would just show up at my mother's house dressed in aprons and announce that we were mini-maids. And there was a gift, and that this was a gift for whatever occasion, Mother's Day, birthday, St. Patrick's Day. And my mother was able to accept, however grudgingly, the thorough house cleaning that was much needed without the loss of her dignity. So be creative. Next, I want to talk about depression. Your loved one may be depressed. Statistics show that about 1/4 of all seniors experience depression. If it is recognized and properly diagnosed, it can be easily and successfully treated. Most suicide attempts are expressions of extreme distress, and they are not harmless bids for attention. Any person who appears suicidal should not be left alone and needs immediate mental health treatment. Non-Hispanic white men over age 85 have the highest rate of completed suicides. What is the message for those of us with elderly family members? If they talk about suicide, pay attention. Most depression among the elderly is valid. It reflects real sorrow, grief, and loss. It is hard to watch a loved one grieve. We tend to want to fix it. Oh, get over it. Just cheer up. Come on, let's go shopping. The older person may make remarks like, what's the point anyway? I might as well be dead. I don't have anything left to live for. Remarks like these tell us just how bad that person is feeling. The wrong thing to do is say, oh, don't say that. The right thing to say is, I know this is a difficult time for you. Come on, let's sit down and talk about it. Let your loved one know that you recognize and respect their feelings. Tell them you love them and you want to know why they're sad. Let them talk. Don't interrupt until they can get their feelings out. As with anyone, depression is a change in the person's usual level of functioning. They may tell you, I stay angry all the time, or I can't take it, I'm just not myself anymore. There are specific symptoms of depression to watch for, some more serious than others. Depressed mood, most of the day, nearly every day, either by the person saying he or she feels sad, or by observations made by others, crying and sad expressions, anger, irritability, marked or diminished interest or pleasure in all or almost all activities, nearly every day. Significant weight loss or gain, decrease or increase in appetite nearly every day for at least 2 weeks, insomnia or sleeping all the time, restlessness or just no energy nearly every day, complaints of fatigue or loss of energy, complaints of feeling worthless, hopeless, guilty nearly every day, difficulty concentrating or thinking or making decisions, a big change in the usual level of functioning, recurrent thoughts of death, suicidal ideation with or without a plan, or a suicide attempt. If these troubling feelings have been going on 2 weeks or more, it might be depression and not just an adjustment to a situation. If you see your loved one struggling to get through each day, it's time to visit the doctor, either your primary care provider or AltaPoint. AltaPoint has a 24-hour crisis line, 473-4423, and this number will be given to you again at the end of my talk. Finally, I want to address how to offer and get help. Sit down and let your elderly loved one know that they can talk freely to you about what they feel, what they believe they need, and what they would like to have happen. It is crucial to allow your loved one a sense of influence and control about decisions affecting their life and their future. What if your relationship has been a difficult one? What if you just know that your loved one will never accept what you're saying? Then call your loved one's doctor and go with them to see him or her. There's often a trust relationship with a family doctor, and he is seen as an authority figure. He can set up things such as home health evaluations. They can come to the elderly person's home and decide what is needed, such as Meals on Wheels or homemaker services. Ask your primary caregiver for a referral to AltaPoint. It is important your loved one's medical doctor be aware of what's happening. You may call AltaPoint for an intake appointment or send information to his or her doctor's office later. And what will AltaPoint do? Your loved one will come in with you, and both of you will be interviewed together and then separately, and questions will be asked and information will be gathered to provide information about what is wrong and what is going on in your loved one's life. They can be started on medication if needed, and referrals can be provided. They can help you talk to your family member. That's a very big one. And get them to understand that you're trying to help them maintain the quality of their life for as long as possible and keep them safe, whether at home or in alternate housing. Most of us do not have time already for the many demands that this fast-paced life places on us, but our love for our parents is paramount. They raised us, and they need us now, just as we needed them when we were growing up. I do not say this is easy, but it is necessary. How can you tell that your parents or elderly friend or relative needs help? Again, here are some signs that your loved one is having trouble. Are there vision or hearing problems? Significant memory losses? Is your loved one experiencing anxiety, depression, phobias? Can he or she still use the phone, read and write, pay their bills, balance the checkbook, drive safely, do housework, prepare meals, bathe and dress properly, or climb stairs safely? Do they have multiple bruises? Has there been a sudden weight loss or gain? Are they making good decisions? Are they taking their medications properly? Are they going to the doctor when they should? Is there food in the house? Do they answer the phone when you call? Are they sleeping at night, or are they sleeping too much? Have they been a victim of fraud or abuse? Are you getting distress calls frequently? Even if your loved one does not have a serious mental illness, they may eventually and probably will need extra help from you. Maybe it is time to sit down with your loved one. Our first impulse is to take over and fix it, just to let our loved ones know that we see that they can't take good care of themselves anymore. Usually, and almost always, this makes the problem worse. Communication is the key here. You must find a delicate balance between ensuring your loved one's health and safety while allowing them to hang on to their dignity and as much independence as possible. And remember, AltaPoint is here to help caregivers too. If you're feeling overwhelmed and sad and angry and lost, we're here to help.